and making it available on our website and YouTube channel. We're not live streaming on Facebook today. Everybody is muted at this time. If you have any questions and you are a parent, please feel free to put your questions in the chat box. If you're a provider, in the chat box right now, we welcome you for joining us today. We want to really make this parent friendly and make sure parents have the opportunity to get their question answered. So if you are a provider, please forward your questions to the email address that I just put in the chat box, covid19@mainecare.gov. They'll be happy to answer your questions. And with that, I'm going to share my screen, and it's going to share the guidance that came out. And Trista Collins is going to take us through the guidance and share and provide a little bit more explanation for our families. And if you have questions, please feel free to ask them, and we'll try to get them answered as we go through the webinar. And if we have the opportunity to at the end, we'll also share questions at the end as well. So with that, I will turn it over to Trista.
Thanks, Carrie. Hi, everyone. Thank you for taking some time today with us to go over some guidance. And thank you, Erin, for joining us too. We have gotten a lot of questions about MaineCare services and, how do we support all of our kids right now? And certainly there are lots of challenges. So what I wanted to do is go over the provider guidance that was put out jointly between the Department of Education and our MaineCare office. This was actually sent out to providers, but there is definitely a parent perspective on this. So I think what we'll do is just go through all the questions and see what we can do to resolve any issues or challenges that people are having right now with access to MaineCare and services. So the first question, very important, and Carrie, can they access the blue links on what you put out?
I can click on them. I can click on them and show where it takes them. Okay. I will put the link to this guidance in the chat box as well so that they can access.
Okay, thank you. So if anyone has questions about MaineCare, we have actually redesigned our websites, DHS has as a whole, and MaineCare to be more person-friendly for providers and for parents and anybody else that needs information about MaineCare. So you can utilize that link for any updates. You can get general information about any DHS services now by going to that blue link. So please make a note of that. If you haven't already been there, it's kind of neat to check out. You will be able there to find out what services you might be eligible for that you maybe didn't know about before. Talks about guidelines for our programs. There's a wealth of regular information on there for you, but there's also COVID info specifically. So if you need help finding a provider, anything like that, you can go right on the website. So there we go for number one. So the second question that we put out was regarding testing. And the question was whether or not staff and students are eligible for testing under the governor's standing orders. MaineCare will cover the testing for all of our members. If a student is not a MaineCare member and doesn't have any other insurance, they can absolutely apply under our uninsured testing benefit. So MaineCare is assisting anyone who needs access to COVID testing with that right now. So again, there's a link where you can get to the governor's standing order, and there's also a link on there, I believe, to a place where you can just put in your zip code and it shows you where all the testing sites are. And it also outlines whether the sites are free, whether they require an appointment, or any documentation that you need to have. So please utilize that if you're needing testing information. All right, now to get to the good stuff. One of the things that I think is important to highlight, is that MaineCare offers a lot of services to members. And I want to make it very clear that our goal is to support all of our members right now and during this extra challenging time, but supporting members in general is what we strive to do. So this was put out in response to our school-based providers who normally would be providing these services during school times, usually at a school or at special purpose private schools, and sometimes in other sites. So the questions that are on this are really related to what do school-based services look like in the pandemic when there are all kinds of different setups. So the first major question that we had was, do all services being provided need to be listed on the member's IEP or Ifsp? And the answer to that really is yes. federal law through IDEA expects that health-related services that are necessary for a member to access their education are listed on an IEP. That's nothing new. CMS, the Centers for Medicaid and Medicare Services, requires that MaineCare make sure that this is adhered to. So this is pretty important. So for school-based services, they do need to always be on an IEP. And there's guidance that we put out previously with the Department of Education that talks a little bit more about that. Let's see. My screen just froze, hold on. Here we go. Next question, where can providers find guidance on what the IEP is supposed to look like when it includes health-related services? Erin, do you wanna chime in on that?
Yeah, we have a specific document linked on the MDOE page around, we altered in March, right, actually when the pandemic was happening, how behavioral day treatment services were listed on the IEP. So we have a website link here. Actually, I think this Trista takes you to the director's corner.
Yeah.
So I'm gonna update that link for you so it takes it to the actual document.
Perfect.
So IEP services, you know, when an IEP team determines that there's behavioral health day treatment needs, those services are put on the IEP as an accommodation, and we have language that supports how those look on the IEP. And then MaineCare and the Department of Education, OMS and the Department of Education work to understand what the IEP would look like in terms of how it would prompt MaineCare reimbursement for those services. So that can be found right there in that link. And it's, you know, again, an IEP determination whether or not a child needs behavioral health day treatment services.
Next question we had was, are we still allowed to deliver our services through telehealth? And the answer is yes. Telehealth has actually been in place long before the pandemic. Providers may not be as used to using it as they have now. I think in our first couple weeks of everything being shut down, we went from like 300 claims a week to like 80,000 or 8,000. There was a lot. So we had a huge jump in telehealth services, but absolutely the answer is yes. We want providers to utilize this. It's safer for a lot of members, and it's resolved access issues for a lot of folks. So the answer is absolutely, please continue using telehealth. And we have a lot of guidance for providers on our website. So if you are a parent and you need services for your child, perhaps you need to access some kind of counseling or something like that, and you're not comfortable taking your kiddo to the office, please ask your provider. Say, do you use telehealth? Is it something that we can set up an appointment for? I know a lot of pediatricians' offices are utilizing it, and it's a great way to get access right now when it's difficult to be out and about.
Trista.
Yes.
So just a follow-up question for families who, when navigating the telehealth for their children, when it comes to any type of medically based service, is it family choice, provider choice? Are providers working with families to individualize the choice? Do you, you know, how is that being navigated?
The choice on whether or not to use telehealth?
Yeah, I know. So for a lot of our families, we hear, you know, my kids need the in-person support. And if the provider's doing only telehealth, you know, is it basically independent to the provider and kind of like local control for school districts, whatever the provider is feeling most comfortable with? I mean, we have very different circumstances across the state. Right now, York County is labeled as yellow with higher incidence of COVID, and then you can go up to northern Maine and western parts of the state and nobody has COVID, and it's not as highly prevalent. So is it just basically specific to each provider and how they're navigating that?
So yeah, providers do have, they get to say whether or not they think they can provide the service. The MaineCare Benefits Manual tells providers that they have to make sure that whatever service they're providing remotely through telehealth has to be the same quality and level of care that a person would get in person. So what that means is if the provider doesn't think they can give that service to a member, they may not agree to use telehealth as the venue for a service. So it really is up to the provider. Certainly if a member wants to see a provider and they're not comfortable with the telehealth, they can absolutely, you know, contact member services and find another provider who will deliver the service. They may find someone else who's more comfortable, or they may find that the service they're asking for really isn't appropriate to be delivered that way. But it is up to the choice. A patient cannot be forced to use telehealth, and at the same time, a provider can't. The choice isn't solely up to the member either. So
it's a work between the provider. Yeah, it's much like working in an IEP process with the school district.
Absolutely.
Okay. So just so you guys know, we did put a link in the chat box where you can find this document, and Erin provided her guidance as well in the chat box. Thank you, Erin.
So the next question was whether or not does MaineCare allow in-person services to be delivered right now? And the answer to that is absolutely yes. MaineCare throughout this entire time has not ever at any point restricted the delivery of in-person services. MaineCare continues to reimburse for the services, whether they're provided in person or remotely, in accordance with our manual. And providers who have decided to open and see folks in person, they do need to follow the guidance that's put out by the Department of Education if they're under that oversight, OCFS if they're running programs that are overseen by our OCFS office, and MaineCare has also put out provider guidance. We all expect that the governor's guidance is followed, and we all have more than one entity generally overseeing services being provided. So it's important that providers realize that they need to check with each of the entities that they're working with to make sure they're following the guidance appropriately. But MaineCare will reimburse for in-person services. All right.
It's just being brought to my attention that Erin's link only went to the panelists, so I'm gonna copy it and make sure it goes to everybody. Just there you go. All right. Sorry. So no, it's okay. It's the world of technology that we all live in right now. We're all working for each other to figure it out. All right. Question number 7 is where we're at, right, Trista?
Yep. Number 7, are MaineCare non-emergency transportation services available for students who need access to MaineCare covered services? Absolutely. Our NET folks are trying to provide transportation. We have a bit of a challenge, as you may have heard, just like most providers do right now with transportation. Clearly, this is a very difficult time, and standards have changed as to how many people you could safely fit in a vehicle following CDC recommendations and guidance. We lost quite a few brokers and transportation providers at the very beginning, and it's been very difficult to make sure that we have the capacity to transport everyone who needs transportation right now. So that being said, if you have a need for transportation for your child, it is possible that you will be asked if you have the ability to transport the child, and we through the brokers, MaineCare, can reimburse for transportation. We can reimburse for mileage, and that may be offered to you from the broker because our capacity right now is a little bit limited. That being said, I haven't actually heard of anyone being denied transportation at this point. Certainly school districts have a lot of different opening plans and reopening plans, and providers are still kind of working through that process, but it is challenging right now. So the broker could determine that the safest way to transport your child could be asking about mileage reimbursement if that's an option. If it's not an option, we absolutely are still also providing lots of transportation right now.
Trista, do you know what the mileage reimbursement rate is?
The rates are per broker.
Okay.
The brokers have the ability to determine the rates, and there is no other way for a parent to be reimbursed other than directly through the broker. The broker system is enacted through the legislative process, so we don't have an option to just pay a parent aside from the broker system. So if you go onto the MaineCare website, you can find out which broker covers the area where you live, and that's who you'd be reaching out to, and they can tell you absolutely what that rate is.
Okay. And then what about transportation to and from school if the child's getting school-based services through 28? Is that an option to get reimbursed through the broker?
Yeah, it absolutely is. So there's a difference though. If the child's going to access a full school day and they're receiving, let's say they're getting speech or OT or PT in the middle of their 6-hour school day, okay? let's say they're in 3rd grade. If the primary purpose of the traveling to the school is to be educated for most of the day, but they happen to be getting a 15-minute or a 30-minute session, MaineCare wouldn't be able to reimburse for that trip, okay? But if a child is being transported to for example, a special purpose private school where they're attending a 6-hour day program, that's a little different because the medical service is lasting 6 hours. So we would be able to reimburse in that scenario. Our federal folks at CMS do not allow us to provide reimbursement when the primary focus is academic. So that's really the one thing that parents need to be aware of.
Okay. Somebody's asking if the rates have been increased, but what I'm hearing you saying is the rates are specific to the broker.
Yeah.
Okay. So if you want to know what the reimbursement rates are, you'd have to contact the broker for your area.
Yeah.
Got it. Okay.
Yep.
I think we're on to question 8.
All right. Can a child access the Section 28 services in a school-based program if they do not have the service identified through an IEP or an Ifsp? Well, the technical answer to that question is yes. There's nothing in Maycare policy that says it has to be on an IEP. We know we have kiddos accessing some of these services, and that's fine. What I will say, though, is that if your child does have an IEP, and your IEP team has met that you are a part of, and the IEP team as a whole has determined that the child needs that service, then it should actually be on the IEP. Does that make sense, Carrie?
Yeah, it makes sense to me. Erin, did you have anything to add to that?
No, it's kind of tricky, but essentially you can carry 28 services without an IEP. It's very unusual though, because most kids, have who get Section 28 services would also qualify for an IEP. So that doesn't help you, but you don't have to have an IEP to qualify for Section 28.
Right.
So this would apply to kiddos who would not necessarily have an IEP, but getting 28 services.
Yep, absolutely.
Gotcha.
Yeah.
Okay, thank you.
Of course. Number 9, if school is virtual in the fall, or now, our student, or if the parent or guardian elects to register their child for virtual learning, are students still entitled to receive Section 28 school-based or Section 65 behavioral health day treatment services? So the answer to this is also a little tricky. MaineCare will absolutely reimburse for Section 28 services or Section 65, regardless as to where the service is being provided. That means the service can happen if the child's remote at home. Services can be provided in person, or they can still be provided at school. Or in some cases, if school districts have decided to utilize other space because it's safer, we will also reimburse for services provided at that other location as well. So the big issue here is that parents need to be in communication with their IEP teams to determine what services are going to be provided to the child. And then MaineCare will absolutely reimburse for any services that are provided and billed by the providers in accordance with our manual. Erin, did you want to add anything about that?
No, I just think it's not, the reimbursement is separate from if a provider will provide the service.
Yes,
if that makes sense. So some students get Section 65 behavioral health day treatment in a school, but they may not have a provider to provide in the home. And then there are private agencies that have providers that may be providing services in the home. The Section 28 services are largely home-based for the most part. So they're definitely happening in the home. So I think it's not dependent on if there's a human being attached to that, but they will reimburse for the service if it's being done.
Yeah, and I think it's important too that, school districts have the option to contract out some of these services. I don't think there are any school districts that are providing in-person services in homes right now. Erin, are you?
No, mostly not. And I know there's also a backlog of people trying to get these services in the home through a different, so that's an issue as well. Yep. Because before COVID hit, we didn't have enough people to work in homes to support functional skills. And the main thing here really to pay attention to is that typically MaineCare would only provide these if they were school-based services. They would only provide them if they were in the brick and mortar called whatever school you were in. And so this really speaks to the fact that there's some flexibility in where the services are offered based on this pandemic. So if it's a third-party location, the services won't be halted because it's not at, Westbrook Elementary School. So that's kind of the flexibility that's come with this. And we still have a personnel shortage, and we're trying to deal with that all over the state in every capacity. But it gives us some flexibility in how we can provide school-based services in home settings, which is different.
Yeah, I think it's good too. I mean, the school districts are doing a lot of things. They're trying to creatively meet the needs of students all across the state. And, I'm thrilled that there are schools that are contracting providers when they don't have staff to send to kids' homes. It's really good to see them contracting with some other providers so that they can go into the homes. So it's good that we can support the flexibility that the schools also have right now. This may be unprecedented, and I think to have both of our departments having some flexibility in providing this, but it's a very good thing.
Yeah.
Right now.
Just to make sure that we're providing clarification for families, because I think where this gets confusing is school districts who are providing school-based services and have trained their own BHPs, and those BHPs are employees, direct employees of the school district, are, for the most part, not that we've heard of, going into homes at this point in time because they're school district employees. So they're employees of your local education agency or RSU or SEA. We have how many different acronyms for that. But if your school district is contracting through a provider who's providing the BH support in school, for the most part, those providers across the state have resumed in-person support. And if that provider is providing in-person support, they are able to come into your home because it's the provider that the school district is contracting with and not a direct employee of the district. I just want to make sure that we are being 100% clear on that.
Yeah.
I mean, Carrie, that's a great point, and you could run this talk right now. It's very true that Section 65 is a certification program that EdTech 3s go through to be able to bill MaineCare for medical services, but it's not attached to who you're employed with, right? So if you're employed with an agency, let's look at Connections for Kids, and those members of those agencies work in the home, they work in the community, they can still do that. But if your BHP is employed by a school district, there's a lot more that's going to prohibit that from occurring. So they're not typically working in homes, and we talked about this on my call last time. So that's why there's multiple agencies out there that work with contracting staff to work in homes through Section 65 and through Section 28, and those are the agencies that can provide services here.
So as a parent, you need to make sure you're clear when you're getting the school-based services, who's actually providing it, the district, or is it a contracted provider in order to obtain in-home support?
I want to clarify too that if you're getting a school-based service, let's say on a remote day, let's say your kiddo has 1 or 2 remote days, if you have someone providing a Section 28 school-based service, it would have to be during a time, we would expect that be running in accordance with whatever school plan your child has. So for example, if your child has Section 28 school-based program on their IEP, and the school expects that child on the remote day is doing 2 hours of education, then we would expect a school-based service on that off day, on that remote day, to be provided for that 2 hours. We would not expect to see anyone getting 6, 7, or 8 hours of a Section 28 service because we know that there isn't a school program that's happening for that same duration of time on a remote day. Does that make sense?
Yeah, and I think this is also where the confusion sets in, because we're telling parents and U.S. Department of Education is telling parents that nothing has been waived in IDEA. So your child is expected to get their full services, accommodations, and modifications on their IEP. And sometimes for parents, you know, that is meaning that if there's direct instruction listed for a certain amount of minutes on their child's IEP, if they divide it up amongst 5 days a week, that their child's supposed to be eating this much time per day. And this is where it really means you've got to work with your local district and work the IEP process to find out when and where that instruction is going to happen, and where the IRLP, the Individualized Remote Learning Plan, comes into play for your child, and why you should be working with your district to get one of those in place so that you know what the accommodations and services and modifications are going to look like in a hybrid model when you are remote. And so it's where it's very confusing for parents, and I understand the confusion because you're navigating two different systems who are trying to work together to give students what they need, but there's different rules around each one of them. And while you're both being flexible, which is great, it's down the line has led to some of these questions and why we're providing this guidance. But I understand where the questions come from.
Yeah, and the remote learning plans, if the remote learning plan says that the child's going to be doing 2 hours of school or an hour of school, that's what we would expect to be matching, because we understand the remote learning plans. Erin did a really nice presentation, what was it, last week, that explained that process. And, you know, again, we want to support the education that's happening. And so school-based programs, we would expect to align with the remote learning plan that's in place for the student MaineCare member.
Yeah, these services are really tightly connected to goals, and they're not really meant for general care. So they are, you know, that's not something that you could elicit support in for, you know, there's specific goals and there's narrowly focused time. So if your remote learning plan is less than a full day, which most are because most children can't tolerate 6 hours of online instruction, then that would have to coincide with that. However, Section 28 services are often more functionally based, and Section 65 can be more academically based much of the time. So there can be, which leads to our next question about the staff, right, Trista? We're going to get to that, but
we will next.
Yeah, so it is very confusing. So if you have specific questions about like a case, we'd be happy to answer them. But basically the take home here is that what used to be offered in school and could be funded at school, there's a little bit of flexibility because we understand that school is happening in different locations than it usually happens. So that's kind of, if you can kind of take that with you, that is something that, and I've talked to directors now to say, how can we supplement or provide more in-home support through some of these agencies that are already working with the kid? Because that might be something where we can do more to align goals of the IEP and functional goals to get as much as we can for whatever child we're working with.
Yeah, I'm going to elaborate a little bit further down on the actual home and community service, but for the actual school-based service, yeah, that was a yes on number 9.
So somebody's asking about, speech or OT services that are on an IEP being billed under Section 28. They're not billed under 28. They can be billed under MaineCare, but it's not a 28 service. It is a medically based service that if parents give permission for schools who are doing OT, PT, or speech in schools to bill MaineCare, the schools can bill MaineCare for those services, even if they're providing them via telehealth right now, correct?
Yeah, that's correct, absolutely.
But it's not a 28 service.
It is
it's
not.
Separate from 28.
Yeah, and we would not expect concurrent billing for that time. So we would not expect to see a BHP at the same time as someone doing remote speech therapy.
Right, because a speech therapist is a therapist at that time.
Correct. We would not expect the concurrent billing. That being said, there's always an exception if there was a circumstance where if the service couldn't be provided unless there was that support, that would have to be reviewed very carefully, and it would have to go through our prior authorization approval with the provider who's doing the 28 service. But generally, we don't expect to see that at the same time.
Gotcha. Okay. Thank you.
Okay. Number 10, our district is holding special education classes In a location other than my child's normal school, can they still receive MaineCare? Absolutely. We're going to support the services where they're happening right now. And number 11, will MaineCare pay for one-to-one support that I receive from my child's school district? So yes, MaineCare will reimburse if the school district provides a service that's delivered in accordance with either Section 20 or Section 65, absolutely. What I will say about the answer to this question, as Erin alluded to, you know, we have the home and community Section 20, which is a little bit different. We know that there are needs happening, that sometimes people need additional home support right now, and that's fine. We know that some parents are working with providers to adjust the time that they're working with students in order to support activities that have changed during the daytime. For example, if a provider was servicing a child in the evenings and the parent decided that now, because remote learning is happening, they need some extra support, the parent's gonna, you know, work on the instructional piece, and the BHP wants to be there to support the child in the behaviors and in following through with the treatment plan, that's absolutely fine. The home and community service can be altered as far as the treatment plan and the treatment goals in order to support what else is happening in the home. It's very important, though, that we understand that this isn't general supervision. A BHP can't change their hours in either the school-based or the home and community to just be there to generally supervise while a student is doing some kind of educational online program. General supervision is not something that MaineCare can reimburse for. That's federal guidance that we have from CMS. We are not allowed to pay for instruction or that kind of supervision. If a student needs support, and the treatment plan is updated accordingly to support behaviors that are happening while that learning is taking place, then that is something absolutely that can be supported by a BHP in the home and community program. Does that make sense, Carrie?
Yeah, I think what's important for parents to remember is that just like in IEP, you have a plan for your child's Section 65 or 28 services. And what you need to make sure you're doing is that if your child is receiving some school-based support at home, that it aligns with the current plan that's in place. And if it doesn't align with the current plan, working with your provider to adjust the plan to make sure it aligns to meet the medically based needs that your child has at the time. And so, you know, for a lot of our kids, they're using technology right now to access their virtual learning. So you can write goals around using technology because that's a way in which your child is communicating, and how to work with your child to appropriately use that technology while accessing their school-based work. You know, there are functional living skills that your BHP is working with your child on while supporting them during doing school-based work. So you just got to make sure it aligns with the plan that you currently have. And if it doesn't, work with your provider to ensure that it does, and make sure that they're okay with that support being given before. Go ahead, Trista.
When we talk about the treatment plans, I know that this was discussed during the last call that was done. You know, this is very similar to the case where you work with your IEP team to come up with an IEP plan. Same with the treatment plan. The providers oversee the process, but it definitely is a give and take discussion process with the parent. So please make sure that as you're working with your provider, that you're telling your provider the needs that your child has so that you guys can write a treatment plan that makes sense to support your child as much as you can. You do need to also kind of be aware that the providers have a lot of guidance that they have to follow by MaineCare. And although COVID has done some things that is allowing MaineCare to provide some flexibility, the providers still have to make sure that their treatment plans are clear and their treatment plans clearly say what support's being provided. So there may be instances where your providers would be pushing back when you're asking for a specific kind of support, because they need to also make sure that what they're documenting is appropriate for the service being provided. We want to make sure that if you need support for your child, that you're getting the level that you need as well. So providers have to make sure that when they're submitting the treatment plans, that they're really giving your child all that they possibly can to meet their needs.
I think what's also important to remember is that your child's needs are so different from pre-COVID times. So, so every 90 days you're supposed to be doing a review. It doesn't mean that you have to wait till that 90 days is up to do that review. Reach out to your providers if you're experiencing different circumstances in your homes and in your life, and that's causing different behaviors or different needs for your child, and ask to have a meeting to update your plans like you would do for an IEP. Be assertive in what you feel you need, and I feel like providers will work with you to try to address those needs within the restrictions that they have.
I think too, along the same lines, if you're talking about updating a treatment plan, I would also make sure that you're talking to your IEP team. We've heard from parents who are looking for more medical support, and then we say, well, have you talked to your IEP team support, because they're talking about, the education's not working at all. But if your district and your folks on your IEP team have no idea that there are new behaviors or new challenges with learning, make sure you reach out to those folks, because they have a lot of good resources as well, and they have good information. And you need to make sure that you're talking to your IEP team if you're having problems getting educational needs met as well. It's hard because you're working, in two very complex systems, but I would be concerned if you're only addressing either just one or the other entity. If you have a child that needs a high level of support, please make sure that you're not forgetting one or the other of the groups in the information part, because I've heard even this week about people that needed extra support with the remote learning, but when I asked them if they talked to their IEP team, they said, well, no, I didn't, I think they're too busy. Or no, they're not too busy, right, Erin? The schools are doing a lot to support these kids right now. Just make sure you're communicating with everyone that needs to be at the table.
Sounds good. Somebody's asked a question. It's a testing question. I'm just going to answer it really quickly because I had this, not necessarily specific to this, but somebody was asking if a child has to go to Boston Children's Hospital for a medical appointment or procedure, do they have to be tested for COVID or quarantined for 12 weeks prior to return to school? And the answer to that is yes. I had this come up, and I specifically spoke with a contact I have at the CDC. And unfortunately, if you travel out of state to Massachusetts, it is not a state that's been approved yet by Governor Mills. And so you would either need to obtain a negative COVID test or quarantine for 2 weeks before being able to return to school.
Boston Children's is doing a lot of testing, a lot of telehealth right now too.
Yeah, all of our medical providers are. I mean, unfortunately for some of these kids who are so medically fragile, sometimes it might not be an option, but always ask about that option. And then Trista did provide us with the testing sites that you can go to get tested as well, to get negative tests. I know the turnaround time on some of the tests are taking longer than normal. So you might quarantine for 2 weeks before you get results back, depending upon where you are in the state. And that's frustrating. And I understand that, but that's where we sit right now, unfortunately.
Carrie, the other thing I would say too about Boston Children's, just because it was brought up specifically, is sometimes they'll do testing at a different campus that's closer. They have campuses all over the place. So that may help with some of the distance challenges with the testing.
Cool. Thank you.
Yeah. All right. Number 12. For the provision of Section 65 Children's Behavioral Health Day Treatment Services, can social worker sessions be held via telehealth? Absolutely. Yes, please. If it's appropriate and you think your child will benefit and the provider is okay with doing it that way, then yes, please provide it during telehealth. Number 13, is there a way for a member to have the same BHP both in the classroom and at home, or at home for both classroom support and other support? Under current guidelines, my child would need a BHP for in-class work and then a different BHP for community activities, which has a long wait list. So the answer is yes. MaineCare policy doesn't prohibit a particular BHP from delivering services in more than one environment. Again, families need to have a conversation with a provider. We need to make sure that if a child needs services, we need to figure out, what does the education plan look like? What support does the child need? What's not working? To try and figure out what service is actually needed. It could be that the child's already receiving a home and community service and the provider wants to adjust their time of when that's happening. Or it could be the child is receiving a school-based service and they need to receive that in their home and they're not doing that. What we have to remember though is that if a child is receiving a school-based service, let's say for that 2 hours on the off day when they're remote, okay? Let's say a kiddo has 2 hours and they think they need services beyond what the school programming is. That's where we have a little bit of an issue, because that's where a child would have to go through the referral system in order to gain access to the home and community-based support for things that are happening in the home during non-school hours. So during time when there's no educational program in place, that turns into a home and community service. And that referral process has not changed right now. So kiddos who do not already have that home and community support would still need to go through that referral system.
It's interesting that it used to be that those services had to be provided by different individuals, correct?
I don't know. I actually checked on that, and I'm not quite sure on that. I checked with a few people who we were looking for history on that. So I don't know, Erin.
Okay, I thought that was a change, just given my work with all of these things historically.
Yeah.
I guess it's really important to try to kind of wrap your brain around the difference between 65 and 28.
Yeah.
And that you know, they're different things and they have different referral procedures for both. One is behavioral and one is really functional. So you have functional.
It is a good thing, though. I do think, you know, obviously consistency is really good for our members, and for anyone getting these kinds of services, it's important. And if there's a way that you can have someone who's familiar to them, who knows your child, working with them, that's going to benefit the member. That's a really good thing. So it's good. Again, there is some flexibility, but we still have to remember that the providers don't have flexibility as far as the referral management process. The home and community providers, it still has to go through that process. What we are saying, though, is a school can contract to provide a school-based service in the home.
So, and what's important to remember is if your student has qualified for school-based services and you have not had community-based services before, that does not qualify you automatically for community-based services. Right. It's a separate qualifying process that you still have to go through.
Correct. And the providers don't have discretion to just all of a sudden start serving, even if let's say the school contracts with a specific provider to provide an in-home school-based service for a couple hours, that provider does not have the ability to just say, well, wait a minute, we can do another couple hours that's not school-based because now we have a relationship with you and we know you. You can't do that. It still has to go through the referral system.
Who provides the referral for school-based Section 28? Can a parent or a case manager submit a referral?
Well, for the school-based, there isn't a referral process for that. They don't go through a referral system.
It's an IEP process, or?
Well, it can come from the IEP if the school has a Section 28 program, or it comes from a provider who's providing a school-based 28 program.
So it's not necessarily it can't come from a parent. It's going to come from the school.
No, it can come
from a provider. It can come from a provider. A parent can contact a provider and say, hey, do you do section-based, do you do a Section 28 school-based program?
A parent can ask the school.
Or a provider.
Or a provider about it, yeah. Okay. Who submits to KeyPro? That would be the school that submits, yeah.
That could be either the contracted person, yeah.
The other thing is there's two different case managers, so.
Yeah, that's.
In the special education, your special education teacher is often called a case manager.
Yeah.
That person, Trista, correct me if I'm wrong, is not someone who would typically refer you in Section 28. The case manager that you're working with in a community program or community agency would be the kind of case manager that could refer to Section 28.
I think it depends, because in some schools that person actually is also submitting the authorizations for the service. So I think it really depends on the context, because there are also some kids who don't have any case managers other than the case manager for the special education at their school. So generally it's whoever would be providing that Section 28 service, that's who would be working through the approval process.
All very confusing. Please call for help if you want to know who to refer to.
Yeah.
Well, yeah, so if I'm a parent and my kiddo doesn't have school-based services and I'm learning about it and I want my child, or I think my child can benefit for school-based services, and let's say I don't have an IEP, what's the best process to obtain school-based services for my child?
School.
The other thing, Carrie, is do
Okay.
you know whether or not your school district bills MaineCare or not,
Yeah.
right? If
Right.
your district does not bill MaineCare, and there are districts that don't bill MaineCare, then this would not be a place where you would get a referral for these MaineCare.
Correct.
Right.
Yeah, and so member services, Carrie, on the back of every MaineCare card is the member services phone number. A parent could absolutely call member services and say, I need help finding a school-based Section 28 provider, and member services can help a parent find an agency.
Okay. But if it's not available in your school, it's not available in your school.
But it could be available at there could be another provider in the area that could still help provide you.
Because they'll bill MaineCare as long as the school is open to that individual coming into their district.
Yeah, there has to be a relationship
Okay.
between the school and the provider.
Got it. Okay. I think that's clear. Thank
A
you.
district that did not bill MaineCare, and yet we contract
Yes.
providers to come in and they
Yep.
bill MaineCare. I
Right.
think
Yep.
Right. Okay. Got it. Thank you.
All right.
that's very confusing. It is, but
It is.
It's so hard.
yeah.
I appreciate that we're doing this by Zoom, but this is
How
better.
many years I hear myself talk about it, and it's like, oh my gosh, it's so confusing.
Yeah. My child requires one-to-one support to be successful in remote online learning. I can always provide that level of support. Can MaineCare cover specialized Section 20 in-home supports provided during school hours? Well, the answer is yes. Section 28 services can be provided in a variety of settings, and services are not restricted to a particular time of day. If the Section 28 time is being changed to support behaviors during that online learning time, again, it has to be part of the ITP that's put in place. It's very important that the providers have that clear documentation to reflect the services being provided. That still has to go through the approval process. So again, families need to talk to their IEP teams and to their providers. And I would say always go to the IEP team first, because they need to know if your child's having a challenge with education. You got to give them a chance, because they're really well informed and they have the resources and the knowledge that might be able to help your student in a way that you hadn't thought of. So the IEP team needs to be consulted with first. Erin, do you have any?
No, I mean, I think that, again, if you think of Section 28 as more functional, it can apply sometimes to school-based activities. So let's say your treatment goal is following a routine independently. And so in that routine, you might be working on some tasks that are school related, but it's not the same thing as, for instance, helping you with your math work. So
Right.
it's just, those treatment goals can be broadly linked to school, but they're typically not about learning and instruction. They're more about, how do I follow a schedule? How do I complete homework independently? Those kinds of things. So that's just the treatment plan guides what the provider can do. And those goals will be very clear to you as a parent, because you'll get a document that says these are the goals. And you will have participation in developing those goals, because as you live with your children at home, you know what skills and functional skills that your children need to work on. So that's why they can be related to schoolwork, but they're kind of loosely connected, because they're more around those functional things that you need to do to be able to kind of, participate in life. So.
Yeah. And it's very true that, there are plenty of kids who may need more instruction, and maybe the district can provide remote instruction. And at the same time, the kiddo may also need additional behavior support while they're getting that instruction. And that's okay. The two need to be working together. But as a parent, please make sure that you're contacting both folks so that we get whatever support can be best tailored for the student.
And you can have your, typically those Section 28 workers are at your IEP team table. Even if they're working in your home on how to go grocery shopping, they're going to be participating in or they should at least have information about your IEP team, because in the best case scenario, they're at the table, because they're working on goals that you're probably addressing as well in some other context.
Yeah, and I think with this emergency, there's a ton more overlap now. I mean, there was overlap before, but working independently on a computer to access your remote learning plan is something where there's just such huge overlap. Where my daughter is in 7th grade, and most 7th graders are able to sit and do their work and complete it with maybe minimal assistance from their families, whereas I need to be right there next to Sammy in order for her to access her remote learning. And so getting her to a point where she can do some of it independently can totally be a goal that her BHP works on her with, and navigating the Google Classroom and accessing the lesson and having her watch the video on her own. And those are all things that she can work with her on, because that's now a functional life skill for her because that's the way we're learning. Yeah. And let's be honest, someday, space and time, when she does go into the workforce, that's going to be a skill that she needs to have.
All right. You want to go with questions, Carrie?
Yeah, 15 because it's a private non-medical institution. I don't know. I don't think that necessarily applies to our group here today. And then Trista, do you want to put your email address in the chat box?
Sure.
And I'm going to stop my share.
I shared the Maine CDC travel guide and information.
Yeah, we shared that with everybody, so thank you. There's Trista's email address.
No, I just sent it to the panelists.
Yeah, it's a habit. And while I don't see any questions right now, but while we wait, I'm just going to put up, for those of you that attended multiple of these, our poll at this point in time. We are nonprofit, grant funded. Happy to announce that we have been refunded for the next 5 years as Maine's PTI. Just got word about that on Friday. So we're still with you for the next 5 years, but we need to collect data so that we can tell the government that we're doing our job. So if you could take a few moments to fill out the poll. And then if there are any other questions that anybody else has, please feel free to add them to the chat box at this time. We'll give you a few moments to do so. And we'll get Erin and Trista just to address those. I think everything else has been answered at this time. I do want to take the opportunity to thank both Erin and Trista. I know their time is very valuable these days as we go through the process of school reentry and helping and assisting parents. So I do appreciate you both coming together and collaborating so that we can have you in the same space and time to get questions answered and less back and forth for families, which is so very helpful for all of us at this time. I'm in the 3rd week of remote learning, and it's been fun. We're doing 2 days in person and 2 days at home, but I'm experiencing what I think a lot of parents experienced. My husband's a teacher and he went back to school, so I had his assistants in the spring. And I no longer have his assistants, and the juggling of 100% work while doing middle school science has been fun. Yeah. But the teachers have risen to the occasion, and I really appreciate everybody. And her BHP has risen to the occasion. So we have a great group of professionals working in the state for our children, and you know, parents just need to continue to assertively advocate as best you can. And we're all here for you. So if you're trying multiple people and can't get questions answered, please make sure to reach out to us. I know that Trista and Erin, every time I've emailed the question, I usually get a very quick turnaround for an answer. So if you're nervous about emailing Trista or Erin or want to remain anonymous, we totally understand that as parents. Email us and we'll respect your privacy and get your question answered. But I know Erin and Trista are both very responsive to getting questions answered for families as well. We're getting a whole bunch of thank yous from both of you for being here and providing this information to families. No questions, which means, yeah, nice job. You answered them all as you went. That's the best type of webinar.
I want to compliment on your knowledge of this because it is very complex. So it makes me feel very good that, you know, parents can rely on you to help them with this or to get them to the right person to answer the question because it's very complicated. And so, you know, I love your theory of just like ask for what you need and we can, the school can and the community can, you know, try to find you support where you need it. for
Yeah,
sure.
I think, and thank you, Erin. I think I want to say I have not a huge staff, but I have a wonderful staff behind me. So it's not all my knowledge. it's a combined knowledge of 9 employees who do a phenomenal job to help families. But our motto at Maine Parent Federation is, if we don't know the answer, we're going to find it for you. And so that's something that we try to do one way or another to get you the answer. And there's been a whole lot of I don't knows in this pandemic world, but I think everybody's doing the best we can, and we're navigating through it and getting answers for families, which your time is so meaningful for us here, because you guys are the ones in the seats in Augusta making a lot of decisions and impacting these families. So taking this time to provide our families with some direct assistance is wonderful. We will be posting this webinar. Somebody's asking about recording. It's going to be on our website, on YouTube as well, our YouTube channel. And it usually takes us about to the end of the week to get it up there. Hopefully in the future, that'll be a quicker process as we look to redo our website. But keep your eyes open on our website. We'll also post it on our social media sites that it's available on YouTube for anybody who would like to watch the recording. And I'm still not seeing any questions. So if you guys don't have any questions, we'll thank you for your time, Erin and Trista. I'll leave the poll up for a few more minutes. If anybody thinks of a question, I'll stay on for a couple more minutes. And if Erin and Trista, I can email it to them and get you an answer via email that way. But I'm going to let Erin.
I can too, Carrie.
Okay. Not seeing anything at this time. Dylan's telling me that he will get this on YouTube tonight. Thank you, Dylan.
Wow.
So it won't be up on our website yet because we have to go through a different website server. But if you go to our YouTube channel, Dylan says he will have it posted on YouTube tonight. So thank you, Dylan.
I'm going to go to my next meeting.
Thank you, Erin.
All right. Thank you, Erin. Have a good day. Well, I'm going to 100% voted. Thank you. I'm going to end the poll.
Can't believe we don't have any more questions.
It's good. It's good. You did a good job.
Thank you for having us, Carrie. I appreciate it.
Well, this was perfect. Thank you for coming, and worked out really well, even though it's, specific provider guidance. I'm hoping it helps to answer some of that influx of phone calls that you're getting. And people can still access it online for recorded webinars. And it, I learn something new every time I host one of these things. So it's great.
It's good because you know what? There's always a question that we don't think of, and we can't possibly think of every scenario. And it's good to have the collaboration with the Department of Education and with you all so that we can all really understand what the challenges are, because we really there's so many challenges folks have, and we just can't anticipate all of them.
Nope, we can't either. So we oftentimes will get a question from a family and it's like, I hadn't even thought of that. Good question. Let's get the answer for you. So
we have to do that a lot too.
Yeah. All right, I'm not seeing any other questions. So I'm going to stop the webinar and thank everybody for joining us. And it looks like a great week of fall weather. So enjoy your first week of fall, everybody, and keep your eyes out for more information coming out from Maine Parent Federation. Thank you for joining us.